I feel like on the heart disease conversation over here, we have LPa, we have cholesterol just in general and all the LDL, HDL. But then on the other side of this heart conversation for women specifically, women going through perimenopause and into their menopausal years, is that you need cholesterol. You need cholesterol to be able to make estrogen, and your brain requires cholesterol to be able to function normally. How do you rectify that? Because in all the work that I've looked at for menopausal women is that we start to see signs of dementia and Alzheimer's when a menopausal woman starts to get on a statin because you've brought cholesterol down so much, which has brought estrogen down even more and has created a damage in the brain. So there's a lot of pieces here. I don't know if you see where my brain is going. Yeah. There's a lot of pieces here that I hold as a 55-year-old postmenopausal woman of like, okay, I'm taking some bioidenticals to make sure that my heart and my brain stay well, but then I also have this issue of LPa. Like, am I just doomed to have a heart attack? And where does that all fit together?
You're definitely not doomed to have a heart attack. And so, heart attacks happen most of the time because of an obstruction of the blood vessels that are going to the heart muscle, right?
Right.
And so what we're really talking about is preventing obstructions and preventing, if you have current obstructions, them getting worse. There's a lot of different ways to do that. Right. It doesn't have to be lowering your cholesterol to minuscule levels. Now, what I will say, though, is that there are massive studies that show lowering your cholesterol prevents heart attacks, okay?
Right.
And so we do have to wrap our head around those studies in people with blockages of their blood vessels and then contrast that with the other problem that you're mentioning, which is brain issue.
Right.
Not having enough cholesterol for your brain to do the work that it needs to do, right?
Right, exactly.
So I think that from what I've seen around the research is that there's giant studies done, like by the Cochrane Institute, that takes major studies and compares them, that in general, for most people, lowering cholesterol does not cause worsening of symptoms of cognitive impairment, okay?
Okay.
Now, here's the problem, is that this is in most people. Okay. And as we all know, with every study, you have this bell-shaped distribution curve of what most people, what works for most people is in the middle of that curve.
Yeah.
But then you have people on the outside of that curve that some people will have worsening of cognitive symptoms with cholesterol-lowering medications. Now, in those people, you're in a particular pickle.
Right.
Now, for you, though, we don't know if that's where you're at, right? We won't know until we actually figure out how we're going to treat your blockages in your arteries if you have them.
Until we see the clearly.
Exactly.
Yeah.
And then what we can do is we can change the dosage of the medications. We can change the form of the medications. Even different statins on different people will have different effects. And so you really got to go down kind of the diagnostic rabbit hole and the treatment rabbit hole with a skilled cardiologist that knows how to deal with all of these problems.
So it's personalized.
It's very personalized.
Okay.
Extremely personalized person to person.
Yeah. So what I'm hoping people are gathering from this so far is that we really need to be checking LPa on our yearly blood work.
Right. Knowledge is power. The first thing is you have to know that there's an issue.
Yeah.
And then know that there's treatment for this. And so if you don't know that there's an issue and you don't do any treatment, you're going to be one of those 50% of people that figure out you have heart disease when you first have a heart attack.
Right. And then if there is a high LPa, then the next step would be to ask your doctor to do a clearly exam.
Yeah.
And then from the clearly exam, you can see if the plaque is hard or soft. And it's the soft plaque that we're the most worried about because that's what can break free.
Right, exactly.
Okay. And so finding the right person to understand that, is that going to be hard for people, or is that you think most people should be able to find a doctor who's willing to go into the clearly exam?
I think it shouldn't be hard for people.
Okay.
And just like we talked about with blood testing earlier, that if there is a physician that you're working with that kind of blows this off or tells you don't worry about it, there's definitely you should always get a second opinion.
Of course,
right?
yeah.
That's why it's called a second opinion.
Yeah,
because
everybody
that first
should get
guy,
one. Yeah.
Right. The first guy just gave you his opinion or her opinion, right?
Yeah.
That's why you get a second opinion to see what are your options, right?